Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Baird Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines for today, the 1st of June. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion is myself, Sophie Bukowski, who's a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics. In the United States, we saw 182,000 positive new cases yesterday, with hospitalizations increasing by 16% and the death rate decreasing by 6%. The overall average cases is now a little bit under 100,000 positive cases per day. In Illinois, yesterday, we saw a peaking 16,000 positive new cases, with cases decreasing by 19%. That is because over the weekend, there were no results. Hospitalizations have decreased by 30% and hospitalizations have increased by 19%. And average cases are peaking right at about 5,000 positive cases for a 7-day average in Illinois. What can you tell us about this big number of 182,000 new cases?
Well, this sixth wave is just really taking off. I mean, it's transmitting more rapidly and more effectively than ever before, and it includes impacting people who are already vaccinated. The only good news of this is that we are not seeing a very dramatic increase in the hospitalizations or the death rate. They are going up, but they were down so low. The capacity, in other words, it's not impacting the capacity of the hospitals at this particular time. But this wave is enormous. And again, as bad as it is, the cases are underreported because the people who are diagnosing themselves with home tests, which is quite a few, are not being counted. So we're presuming, but the hospitalization rate and the death rate, those numbers are very firm, but the case rates are probably at least 2 times higher, if not more.
Wow, that's really unfortunate. Going into our first headline, Italy was once the pandemic's grin epicenter. It is now lifting requirements for visitors. What can you tell us about what's going on in Europe and more specifically Italy?
I'm in Europe right now, actually. I'm in France, and I've been here for on and off for a couple of weeks. I was down in Cape Town and came back here. I was in Addis Ababa as well, in Ethiopia. So I'll tell you what's happening in Africa, which is having their 5th wave, at least in South Africa. They're very strict with the mask requirements. The vaccine uptake has not been very great there, but you have to wear a mask everywhere. I mean, if you go into a coffee shop, you have to wear a mask unless you actually have the coffee cup in your mouth. Every meeting I was at, everybody had masks on. So it's being taken much more seriously there. Even people outside are wearing masks. It's very different. And in Ethiopia, I was only in the airport. Everybody's wearing masks. Everyone on the airplane and in the airport. Can't go anywhere without a mask. Europe is doing the opposite. So since I've been in France, the mask mandates have basically been eliminated, and including at the airport. The airplanes, it depends on the airline, but things really loosening up. And now what's happening is the Italians, who had, of course, a really bad run in the first couple waves of COVID with huge amounts of deaths and older people and stuff, they're loosening up really as well. I had a colleague just come back from Bolivia, South America, and that person had to go through all these testing procedures and stuff. He said nobody ever looked at any of the test results or anything. Here you still have to show, when you get on the airplane in Europe, you have to show your vaccination certificate. And if you don't have a vaccination certificate, you have to have a test result. And going to the United States, you have to have a test result anyway, even if you have the vaccine. So it's kind of all over the place. But Italy is definitely loosening up. You have to keep in mind they had a very high vaccination uptake rate with 90%, which is much higher than here in the United States. And they have mandates for high quality N95 masks on public transportation and trains, as well as indoor cinemas. And all that, it looks like it's in effect at least till June 15th, but then it's probably going to loosen up for the summer months and all the tourists that go there. So we'll see what happens. But it's loosening up in Europe, it's tightening up in Africa, and the wave is rolling.
Wow, that's very interesting. And going into another big city that's having a big change in their restrictions, Shanghai is poised to ease restrictions as infections fall. What can you tell us about the city that was in lockdown for like 2 months? No one could leave their house, and now all of a sudden things are changing as of today.
Well, it's been devastating for residents of China because they've went through these lockdowns before, and it really just freezes everything. Their economic productivity drops. The people are going stir crazy. Many of them been, quote, trapped in their homes for 8 months. There's been some civil unrest, but the policy works. I mean, they have 1.3 billion cases, 1.3 billion people, and they confirmed on Monday that they had 97 new cases. Now think how many did we have yesterday in Illinois?
16,000.
18,000 in Illinois. We only have 13 million. They have 100 times more people than we do, and they have 97, and they're worried about it and locking things down, including 31 cases in Shanghai. And that was the first day since March that China fell below 100 cases. So it's just a completely different way to do it, but that is really so severe. But they're loosening up the lockdown at this point.
Wow, so let's go into our next question. I think this is an interesting question. Can you, Dr. Murphy, go over and cover a bit of what is the new CDC guidelines with travel, both domestically and internationally?
Well, remember, guidelines are not mandates or rules. So like the CDC is strongly recommending now, because of all the COVID, that people wear masks indoors. And of course, it's not happening because it's not mandated. Now, the city of Chicago is re-implementing the vaccine card requirement for restaurants. So, some mitigations are coming back, and there's pluses and minuses about that. But it's going city by city, county by county. And of course, it really isn't going to work unless everybody's on the same page. But the guidelines are. So for domestic, check your destination status before you go, because like I said, cities and states all have different restrictions. If you're indoors on public transportation, wearing a mask that covers your nose and mouth is recommended. So that's airplanes, trains, buses, whatever. If you have any kind of symptom that could be COVID, any kind of upper respiratory symptom, you should not be traveling, and you should get tested. And you should consider getting tested for current infection with a viral test as close to the time of departure as possible, but no more than 3 days. So these are just recommendations. People are not following these recommendations. All right, they don't have any teeth in them, but they are the recommendations. International, it's recommended definitely check before you go to the airport what the requirements are. Some places are still requiring tests, some are requiring vaccination, but it varies country by country. But you can check with your airline as to what the requirements are for that particular destination. And then when you get on the airplane, it depends on the airline whether you're going to have to wear a mask or not. So the US airlines don't require it, but it's recommended to do it. by the CDC. So it's really kind of all over the place. There's really no, there's no real standard. You have to really go country by country and place by place as to what the recommendations are. Coming back to the United States, you still have to have a test. Most people are getting the antigen test. They offer them really, I mean, you can walk down the street here in Paris and there'll be a little tent set up doing free COVID tests. You know, I mean, it's kind of everywhere. You can walk into any pharmacy and get it, and they give you a very official looking certificate with a QR code on it that's coded with your name and identification. And you take that with you to the airport, and then, you know, we'll see if they actually even take a look at it or not. But you have to have the test to check in at the airport.
That's very, very interesting.
Coming back. Yeah, coming back. Mm-hmm.
Yeah. Dr. Murphy, going into our second question that might not seem related to COVID, but I think could be really interesting to cover, its relationship is what is occurring with hepatitis in children right now as the news is spinning out of control with this. What can you share with us about the information that you know and its connection to COVID?
Well, this is a real problem, and there's over 650 cases now reported by WHO, and there's some background where this actually does occur every once in a while, but now there are cases popping up all over the place. There were some 9 cases reported initially in 2021 in Alabama, and Illinois has reported 9 cases. There's a lot more cases reported in other countries in Europe than the United States. There's some association with adenovirus, which can typically cause a respiratory infection or a gastrointestinal infection. There are many different kinds of adenovirus. And so there's in over approximately half the cases or so that have been reported, adenovirus has been found. Now, that doesn't mean adenovirus causes this liver problem. But it can, and maybe either there's like kind of a new strain or type or mutation in the adenovirus, or there's a co-infection. There's even a link with COVID. There's no link with the vaccine because most of the kids getting this are under 5 years of age, under 10 in general, but most of them below 5, and those kids aren't vaccinated. So it has nothing to do with the vaccine, but it may have some link with COVID. That is completely just a suspicion. There's been no real proof of that. Many of the kids have been studied really in depth, and some have had no evidence of COVID. So it's just a totally mysterious disease. It's a very serious disease. These kids are just popping up all over the world, multiple countries, Israel, all over Western Europe, Eastern Europe, Asia, the United States, the Americas, Africa, and about 10% of them are serious enough that actually require liver transplant. So, you know, that's a very serious infection with complete failure of the liver. So we'll be hearing more about this. It's being studied intensively because, of course, people are so concerned. And right now, we really don't know what the cause is.
We'll make sure to do some covering of it on our segment on Friday.
Yes.
Well, Dr. Murphy, those were all of our COVID questions for today. Thanks for tuning in, and we will see you all on Friday.
All right. See you Friday.